Hello, and welcome to the Human Genome Organization Genetic Counseling Pre-Conference. I am Laurie Simone, licensed and certified genetic counselor, and I provide services to patients in both English and Spanish. I am a graduate of the inaugural class of the Genetic Counseling Master's Program at Rutgers University in the state of New Jersey, United States. I am board certified by the American Board of Genetic Counseling and am also licensed to practice in various states. I currently serve as the president of the Latin American Professional Society of Genetic Counselors, known as SPLAGen, which is working to expand genetic counseling services in Latin America. SPLAGen is looking to achieve this goal through advocacy, research, education, and networking. I also practice as a general genetics counselor, primarily focused on pediatrics and metabolic genetics at Hackensack University Medical Center, also located in New Jersey, United States. In addition to this role, I also work as a per diem genetic counselor for Everly Health, providing counseling in various different areas of genetics, including cancer, neurogenetics, and pharmacogenomics to patients across the United States. As a genetic counselor, I'm able to provide a variety of services to patients that allow them to learn more about their genetics and how it impacts their health and their families. I am able to look at the patient as a whole and consider the psychosocial aspects that influence how they make decisions, understand information, and communicate. In my general genetics role at Hackensack UMC, I work with many clinical geneticists and a large team of genetic counselors that focus on a variety of genetic specialties. Our team perfectly highlights how beneficial genetic counselors are to a genetics clinic. We are able to conduct large portions of sessions, allowing the geneticists the ability to maximize their time and use it more efficiently to service more patients. We are also able to provide more of the psychosocial support that many of our patients need when obtaining difficult news or even inconclusive results that do not resolve their diagnostic odyssey. The following videos will highlight genetic counselors from different parts of the Americas and their unique roles. We hope these videos highlight the important roles that genetic counselors play in the genetics community, and we hope that you enjoy this conference. Thank you.
Hello, my name is Gabriela Valverde de Morales. I am Guatemalan born and raised. I also trained here as a medical doctor. Additionally, I have a bachelor's in biology and also a master's in human genetics and genetic counseling from the School of Medicine in Emory in Atlanta. As you can see, I am a little bit of both worlds. In the United States, it's very clear, very different, the role of the doctor and the role of the genetic counselor. I'm in a very special place where, as a doctor, I have been able to receive this training to be a genetic counselor that has, in a way I was not expecting, really complemented everything I learned in medical school. The training is very different. Genetic counseling is just very specialized. So we have the whole aspect of counseling, of course, the psychosocial. So everything that we learn in terms of social, relational, emotional, the family aspect of disease, which is so big in our countries, that has just really helped me understand my patients better, relate to them better, assess and serve those needs in a way that I hadn't really done before as a doctor. And of course, with my colleagues, I also have the ability to bring something new to the table. There are so many tests and so much genetic information that changes all the time. And with this very special training where we are taught to keep up to date, to understand different genetic testing, the technologies, the possible results, the labs, what labs are best at what, all of this information has really allowed me to collaborate with my colleagues and in a way that we hadn't done before, really elevate care here in Guatemala. So at the moment, I am the only genetic counselor here in Guatemala. So it has been a whole adventure. But I really am proud to call myself a genetic counselor. It is a service to my country, to my people. And I hope that we slowly but surely get more genetic counselors in Latin America. Thank you.
Hi, everyone. My name is Jennifer Eichmeyer, and I'm from Boise, Idaho. I earned my master's degree in genetic counseling from the University of Texas Health Science Center, Houston in 2002. And my career has spanned a lot of different genetic counseling specialties, from prenatal to pediatrics to cancer. In 2014, I picked up pharmacogenetic counseling, and I enjoyed that so much that my PharmD partner and I decided to open a small telehealth private practice in which we still see patients for pharmacogenetic indications. But my day job is as a program director for the Boise State Masters of Science in Genetic Counseling program, which I co-created and launched in 2019. The primary job of a program director is to ensure high-quality education for the genetic counseling discipline. And our unique profession requires both a robust understanding of genetics principles, syndromes, and different technologies, while also having extensive communication skills and ability to apply counseling theory and understand family dynamics. It's this focus on the psychological impact on genetic disease and diagnosis that differentiates genetic counselors from geneticists. The ability to teach and deploy these counseling skills with compassion and dignity is a significant component of the educational experience for genetic counseling students. And while most master's degrees are around 30 credits, the majority of genetic counseling degrees are closer to 60 credits. So there is a vast amount of information included in the genetic counseling curriculum, and that only continues to grow with new knowledge and advancements. But that's something that I love about genetic counseling. I've been able to span so many areas of medicine, from cancer to medications and now to education and advocacy. I love that I've been able to touch entire families and in some cases generations of families and help them through their genetics journey. And I also appreciate that genetic counseling is well suited for telehealth. In my telehealth practice, I've been able to reach rural patients that otherwise would not have access to specialty care. So I feel very fortunate to have entered the profession of genetic counseling. It's been dynamic, it's been challenging, it's been invigorating to continue to learn for over 20 years. And that's why I really appreciate being a genetic counselor.
Hello, my name is Stefania Alastre. I am originally from Caracas, Venezuela, but have lived in the United States for about 18 years. I attended the genetic counseling program at the University of South Florida, where I completed my master's degree. And now I am practicing as a licensed certified genetic counselor also here in Tampa, Florida. I obtained my licensure directly through the Department of Health, and my certification was provided after passing the board exam, which is provided by the American Board of Genetic Counseling. Now I am working in the cancer world. I specialize in ordering genetic testing for patients that have cancer at a younger age than expected, or have a significant family history of cancer, or have a rare type of cancer. And it's really exciting when we find the genetic mutation that is contributing to the cancer in the patient and or their families, because usually this is information that is highly sought after, and it can help us not only in treatment selection, but also in providing patients with screening opportunities to detect cancer early or prevent it altogether. So super exciting to work with patients. And it's also super exciting to constantly be surrounded by the latest technologies and advancements in genetics. For example, right now we're learning a lot about RNA analysis and CRISPR-Maves technology, and how both of those are being used right now to help in variant curation. So overall, genetic counseling is a super exciting career. I love being involved with patients, and I love being surrounded by the latest advances, and I can't wait to see where we're headed.
Hi, everyone. My name is Enrique Lopez, and I'm a genetic counselor practicing in Paterson, New Jersey, in the United States. I was originally born in Brazil, in Porto Alegre, and I've been moving back and forth since. Half my family from Spain, half is from Brazil, and so I get to practice in Spanish and Portuguese, which is for me personally very rewarding. I graduated with my master's in genetic counseling in 2021 through Rutgers University, and I previously had a bachelor's degree in biology that I graduated with in 2019. Since graduating from Rutgers with my master's, I've been practicing as a pediatric, prenatal, and cancer genetic counselor, and I like pediatric genetics the most, which is the most frequent I practice in. And I like that just because I get to have continual care throughout the years with some of my patients, and I get to work with kids as well as parents too. One of my favorite aspects of my job is being able to practice in Spanish and Portuguese. I practice in Spanish probably more than 50% of my time, as the location I'm at, the majority of individuals are only Spanish speaking. And so for me, it's very rewarding to convey a lot of this complex genetic information in like simple terms to them, and to be able to process some of the emotions in their native language. And it's a really nice cultural connection. Genetic counseling definitely has its ups and downs, but in general, it's a very rewarding profession, and I wouldn't change it for anything. I love to help my patients, to be able to give them some type of answers. Sometimes we're not able to give answers, but hopefully we're still able to give some clarity and some direction where they're supposed to go. And it's definitely a profession to look out for in the next upcoming years, just because it's growing so much. But thank you for listening to me.
Hi, everyone. My name is Laurie Redondo. I was born and raised in Santo Domingo, Dominican Republic. I am a laboratory genetic counselor based in Toronto, Ontario. And I have an honors Bachelor of Science in Genetics and a master's in Genetic and Genomic Counseling from Cardiff University in Wales. I'm also Canadian board certified to practice genetic counseling in Canada. My role as a laboratory genetic counselor is a unique role that differs from traditional genetic counseling roles. What I love about my job is the opportunity to learn from various specialties at once. And this is all because of the tests, the differing tests that we offer, which is prenatal, hematology, and cancer. I also love being the bridge between clinicians and laboratory staff. I believe that genetic counselors are uniquely trained individuals, as they do not only possess the scientific background and knowledge required for patient care, but also the empathy and counseling skills needed to address very difficult and strong emotions our patients have throughout the process of genetic counseling or genetic testing. Our training equips us with the tools to empower each of our patients to make the best decisions for themselves and their families, which is ultimately the core goal of our service.
Hi, everyone. My name is Erica Ramos, and I am talking to you from just south of San Diego in Rosarito, Mexico. I'm originally from the Midwest, from Wisconsin, and trained as a genetic counselor, graduating back in 2001 from the UC Irvine Genetic Counseling Training Program. I'm a board certified genetic counselor. I was licensed in California for a while, but as I no longer see patients, I don't keep that license. My job is as the Vice President of Medical and Scientific Affairs for a company called Genao Medical. My team does a few different things, mostly focused on helping other clients build up programs that involve genetics. That includes health systems who are looking to launch innovative programs to more broadly offer genetics to their patients. It includes new laboratories who are looking to make sure that their lab testing and processes are clinically appropriate and useful to our clinical teams. And now, especially in the last year, it's included biopharma, really thinking about how genetic counselors can play a role in helping to build clinical trial work, to build protocols that help to assess drug discovery and other things, and then how we actually prescribe those medications, how we assess eligibility for treatment, things along those lines. So I love my job. I was a clinical GC for a long time, and now it's been really valuable bringing that clinical experience through to helping bigger clients and more clients actually execute on their plans to introduce genomics and genetics more broadly in the US and around the world.
Hi, my name is Emilé Moura. I was born in the state of Minas Gerais in Brazil, but I currently live in Houston, Texas in the United States, and I work as a genetic counselor. I completed my undergraduate studies in biology at the University of Evansville in Indiana in May of 2020, and I also got a minor in psychology at the same university. In August of 2020, I began my 2-year-long master's program in genetic counseling at the MD Anderson Cancer Center, UT Health Graduate School of Biomedical Sciences in Houston. During my 2-year master's program, I took classes in prenatal genetic counseling, cancer genetic counseling, medical genetics, statistics, bioethics, as well as contemporary topics related to the field. And I also had to complete a thesis, which for mine, I focused on the experiences of racial and ethnic minority patients with genetic counseling, since there is still limited data on this population. Another big component of my master's training was my clinical rotations. So I participated in the genetic counseling care of over 300 patients with a vast array of indications and diagnoses. And besides my 2-year-long master's program in genetic counseling, I am also certified through the American Board of Genetic Counseling. I currently work for UT Health in Houston as a full-time genetic counselor. I spend about 50% of my clinical time in the hemophilia and thrombophilia clinic, and the other 50% of time in the general genetics clinic. I truly enjoy being able to work with different patient populations, and I especially love the variety of indications I get to see in both of those clinic spaces. I think that one of the most rewarding parts of my job is being able to offer psychosocial support to my patients. I think we can all probably imagine that having a genetic diagnosis has many impacts on not just the patient, but also their family members. So being able to help them process that diagnosis and help them through that journey is really rewarding. Genetic counselors play a very important role in the care of patients, and I believe that with more genetic tests being approved every day, genetic counselors are really key. We can help patients understand the genetic tests and make informed decisions, as well as manage their expectations and also help them cope with all the implications that come with a genetic diagnosis. Genetic counselors can fit into so many different spaces in healthcare, and our unique training in both science and psychosocial counseling really makes us an indispensable part of the healthcare team. Thank you so much for letting me share this information with you today, and I would be happy to answer your questions. Thank you.